Hello, everyone. Thank you so much for coming out tonight. We're very blessed to have Dr. Evelyn Stewart speaking to us this evening. Dr. Stewart is a researcher and a psychiatrist, a child and adolescent psychiatrist who specializes, amongst other things, in the study and treatment of obsessive-compulsive disorder. And she is the founding director of the pediatric OCD clinic at BC Children's and Women's Health Hospitals. So it is a great privilege to have her share her time with us tonight. She comes from an incredibly current and vast amount of knowledge and practice. So please join me in welcoming Dr. Evelyn Stewart.
Sorry, a little bit of a delay there in figuring out how to get my camera turned on. I'm so pleased to be here this evening, and thank you so much. I took a look outside at this beautiful weather after we've all been housebound for so long and thought, oh heavens, to about see who's going to show up for this thing. But very appreciative of anyone and all of you who've opted to take some of this time this evening as we talk and think a little bit about anxiety in children and how to best manage that, and not just in normal times, but also at the times we're in right now. So I'm just going to share my screen, and despite a year of practice of being on Zoom and all of this all of the time, I'll just ask for apologies ahead of time if there's any little technical glitches in the next chunk of time. And what I hope to do is I'm going to skip over some of these slides, but I'm very happy to share them all with you, and to allow us to kind of jump to the things that are important for you. So basically what I'll be talking about largely is anxiety in children during COVID. I just want to acknowledge a number of different sources of support that we've received, and then actually one that isn't added in here yet is the Children's Hospital Foundation. But really the goals for the next hour or less, because we all need to get out there, it's very good for everyone's mental health, is to talk or learn about differences between what's normal childhood fear and anxiety versus what we would call an anxiety disorder. Have a few minutes for Q&A, then to talk about what are appropriate treatment and prevention approaches. And then lastly, and I'm going to try and sort of push forward, if I could, the first few sections of this session in terms of giving us a chance to talk about mental health outcomes, and specifically around anxiety during the COVID era. So this is just a slide of a picture, if you will, of our survey. We call it the PICS survey for short, Personal Impacts of COVID Survey. And this is a survey that we developed about a year ago in recognizing that, well, I became quite concerned not just about the infectious disease implications, but the mental health implications of this pandemic for our young ones. So really the first goal is to look at differences between what we would call normal, but again, who knows what normal is? Let's just say functional fear and anxiety versus anxiety disorders. So again, back to basics, sort of human emotions. Emotions and thoughts are the main drivers of behavior for all of us. And Ekman, way back in the 80s, was able to identify that, you know, these are very normal things. So universal human emotions, whatever tribe or area of the world you come from. These include happiness or joy, sadness, anger, disgust, surprise, and fear. And these are, might be familiar to those of you who may have seen the movie Inside Out, which is a Pixar film. And we're going to test my fear here about technology and see if we can get it to go. Let's see. Okay. I'm thinking you guys aren't seeing anything because I'm not seeing anything. We'll try again. There we go.
So, Riley, how was the first day of school?
Fine, I guess.
Did you guys pick up on that?
Sure did.
quiet. Something's wrong. Signal the husband.
Uh-oh, she's looking at us. What did she say?
Oh, sorry, sir. No one was listening.
Is it garbage night? We left the toilet seat up. What is it, woman? What?
I'm joy. This is sadness. That's anger.
What?
This is disgust. And that's fear. We're Riley's emotions.
Yep, so those are emotions, brought to you by Pixar. And they are things that are very normal. It's a part of what makes humans human, if you will, and nothing out of the ordinary. So we all of us who are here have experienced all those things. Doesn't mean there's anything wrong. It just means we're human and we all have feelings. So human emotions are kind of like gut feelings. They're just how you feel in a given moment. And it, again, doesn't mean there's a particular problem. So if we're going to talk about fear in childhood, this can be expressed in many different ways, with tantrums, clinging, stomach aches, questioning, and there's lots of different normal fears that happen as a child grows up and goes through their life and figures out different parts of the world. So it's normal for an infant to be afraid of strangers, loud noises, and these are sort of protective, if you will, for toddlers or preschools to have some fear around being separated from their loved ones, afraid of monsters or the dark, for school kids to be afraid of when they're faced by new challenges, new tasks, are they going to be able to do it or not? And teens in particular around social kind of fear. So some of the core fear for adolescents or teens are peer rejection or maybe failure and things. And the thing, so fear, again, normal. It's a normal thing as you go through life. And it's definitely not a reason to not get your child to continue to face something. So if your child is very afraid of strangers when they're an infant, that doesn't mean that you never introduce them to another human being the rest of their life because they will be strangers. Really, it's something that's an opportunity for kids to grow, to better understand the world, and really exposure is a key part of that. And recognizing that they're able to be successful and to face those things that may be uncomfortable initially and very normative from a developmental perspective. And again, we're in a time of COVID, so I can't tell you how many times people have asked me, well, isn't it normal to be fearful of these things? And I would say, yes. And it's adaptive to go to a certain extent, but as parents, and I guess as a clinician and a parent for me, it's important to kind of understand where that line, if the line has been crossed to a point where it's no longer sort of this normative, helpful kind of thing in your life and becomes sort of maladaptive, if you will. So in terms of fear and anxiety, these are, again, that can be very helpful. They can alert the child to danger signals. Fear is an emotion that happens just in the moment about a known threat. And again, it's adaptive. So you go back, talk about cavemen trying to escape from lions. It sharpens your senses. It makes you think a bit quicker. Maybe it puts more blood to your muscles so you can run away faster. And I will try and see if I can go to this one again.
Ever wonder why you feel the way you do? Well, get to know your emotions. When the unexpected is staring you in the face, fear is there to keep you safe. With speed and wisdom, fear assesses the situation and settles your nerves in his own special way. He's got this. Thank you, fear. Get to know all your emotions with Disney Pixar.
Yep, so that's fear. So it can be adaptive at point, brings all your attention at once, things fully in focus. But that's somewhat different from anxiety, where anxiety tends to be something that happens in kids and adults about worry about something negative that will happen in the future. And very often that's sort of unknown or not well defined. So it's not like the spider that dropped right in front of that Pixar character's head. And again, it's enabled an ability to relive experience, and there's sort of an imagining of future, and while you're thinking about a sort of a future bad thing, you might feel this intensity, even though it's not proven. What that does, what anxiety does, is it leads to less risk-taking and focus on global achievement. So again, fear and anxiety can be really positive things from a kid's perspective. And I'll just say, I note that I think someone's joined us, and I'm just thrilled that we have folks joining us, but if I could ask folks just to mute your mics, just so we don't hear anything embarrassing. So, and trust me, in the last year, there's all kinds of things you hear that people might not want you to hear. Oh, yeah. And again, we all have lives where there's imperfect everything going on. So the thing about fear and anxiety, as I say, can be helpful. It can improve your performance to a point. And this is sort of a classic thing that's, I think, taught in probably high school psychology, where it's this known phenomenon among humans that as you increase tension, arousal, or anxiety from lower to higher here on the x-axis, to starting from low, your performance as you go from very, very low arousal or anxiety to sort of moderate, your performance gets better. So for me, like in terms of pulling together the slides for tonight, I couldn't be bored. I had to have a little bit of arousal to realize, oh my goodness, I know I gave a talk last night, but I still need, it's very important for me to pull it together tonight. So that was fine, and hopefully it's going to go fine. We will all see. You guys will be the judge. But the thing is, if it had happened that my arousal or anxiety went too high, I could have froze. I could have frozen. Oh, I can't open my slides. I don't know how to do it. I forget all of this kind of stuff. So anxiety is an important factor for kids and adults that can influence performance. And we see this in schools and definitely at home. And again, when you're doing a difficult task, it doesn't take a lot of stimulation to bring together someone's attention, to help them perform better. But on tasks that are like really, really easy, you might need a little more arousal or anxiety to get going. So all of this is just to say that anxiety is not a bad thing. So if you're a parent and you're saying, oh, my child has anxiety, that's awesome, because that means they're developmentally normative. Everything is as it should be, because anxiety is a part of life. And it's just very involved. And for a child, youth, adult, elderly individual, learning how to manage these different things and move forward in life to achieve your potential is fantastic. Where we become concerned, so for my sort of, I guess, work life perspective as a child and adolescent psychiatrist, is when things move into the zone, like past on the right part of those graphs, if you will, where fear or anxiety go wrong or overreact. And if they begin to impact functioning or impair functioning at home or with a family, in school, or with friends, that's when we become a bit more concerned and say, okay, what can we do here to minimize this or prevent this from becoming more of a full-blown disorder where it gets in the way? And this is going to be, I think this is the last video clip, and you guys will be spared future video clips, but just to share with you a little bit from the Anxiety Canada website.
You know what anxiety feels like.
Wait.
We all do. Everyone experiences anxiety in some way or
Okay,
another.
now I'm experiencing
It's something
anxiety.
that connects
Here we go.
all of us together. Why we feel anxiety and what it really is, that may surprise you. Without anxiety, we'd all be in serious trouble. As soon as your brain senses you're in danger, a little piece of it, called the amygdala, kicks in. It gets your body ready to react. That could mean fight, run away, or shut down. It's called the fight, flight, or freeze response. This reaction goes back millions of years to our distant animal ancestors. Animals whose amygdalae were more sensitive to danger were more likely to stay alive and off the menu. Over millions of generations, this developed into the system we all know as anxiety. So you see, anxiety itself is not all bad. But when there's no immediate life or death threat, and your amygdala keeps telling your body that you're in danger, that's when anxiety becomes a problem. Your amygdala doesn't know the difference between getting eaten and public speaking or failing a test. Human society has only existed for a relatively short time. It's messy and complicated and confusing, and our amygdala just haven't had time to catch up. So sometimes, when we're in uncomfortable situations, our brains misread the risk and overreact. Our hearts beat faster and we breathe heavily, pulling more oxygen into our bodies. The muscles in our arms and legs tense up and fill with blood. Our skin perspires to cool us down. This would all be great if we needed to fight or run, but instead, we just feel tense and sweaty. Sometimes our minds go blank and we feel like we can't move or talk. That would be great if we needed to hide. Instead, we just feel stuck. When things trigger our anxiety, sometimes we try to avoid them, like our ancestors avoiding a predator. But that can cause problems when those triggers are important parts of life, like going to school or meeting new people, things that won't just give up and go away. So how does knowing all this help? Well, it starts with remembering what's really going on. There's nothing physically wrong with you. It's just your amygdala trying to tell you it thinks you're in danger, even if it gets confused about how much danger you're really in. Understanding why we feel anxiety is an important step in learning to manage it.
There we go. Yes. So in terms of what an anxiety disorder is, I thought I find it's better for youth or kids to explain some of these things rather than having me as a talking head talking about it to you. So that's why I'm subjecting you to my some of my technical challenges about trying to access these little videos. But in terms of something we would call an anxiety disorder, we would not do this unless the anxiety that is being experienced by a child or a youth is significantly impacting their functioning. Nonetheless, these are something that impact approximately 10 to 15% of kids. And like I've said before, we would only call it that if they're impairing function or causing clinically significant distress over a period of time. So the tricky thing with anxiety that I'm going to talk about in the next section, and we're pretty much done this section, is to talk about what parents get drawn into out of the goodness of their heart, out of the best of their instincts, which is to protect their child from having to feel this thing called anxiety, and sort of enabling avoidance. And you would say, okay, what's the problem with avoidance? Then I'm keeping my child from feeling anxiety. They're not going to be distraught. No problem. Well, the problem is that it's important for them to go out into the world and experience new things. And that's a really important part of brain development and human development. So if you're keeping your child from feeling this thing called anxiety, actually what you're preventing is some of that normative growth that kind of needs to be experienced. So the most common anxiety disorder among the anxiety disorders would be something we call generalized anxiety disorder. It's something where a kid or youth or an adult experiences accessible anxiety or worry most days about many different events. So these are people who are like gold medalists at being able to worry about anything. They could watch anything. You could go through any part of life and they could think about the danger in it. And really the worry is hard to control. So again, it's not, if we're thinking back to those other things, it's not serving that function of helping the person escape from something dangerous, but it's kind of over firing. And in this thing that we call generalized anxiety disorder, there's other things that are connected, including irritability, difficulty concentrating, difficulty with sleep and energy, maybe feeling keyed up or feeling muscle tension, which can be expressed, as headaches, stomach aches, that kind of thing, and with clinically significant distress. So in terms of childhood, again, as a part of kids going through life, there's different anxiety disorders that tend to emerge. Separation anxiety disorder, this is the one that can interfere with development, tends to pick up first. And of course, it's fairly obvious because that's one of the first challenges in life where the kid is going to be left alone. Selective mutism, specific phobias, then generalized anxiety tends to occur, followed by social anxiety disorder, which makes a lot of sense because for teens, those connections with peers can be, and developing and learning how to interact and to tolerate feeling anxious is an important developmental step, followed by panic disorder. So what tends to happen in terms of these disorders is there tends to be a shift from more concrete to more abstract worries. In terms of related disorders in childhood, those include obsessive-compulsive disorder, post-traumatic stress disorder. So again, just in summary, when we're talking about anxiety and fear in kids, those are very different from talking about a disorder. So all of you have kids, I've got kids, all of our kids have been fearful, and all of us have and had anxiety. So fear is a normal gut response in the face of a perceived threat. Anxiety is, normal worrying about some bad things that could happen in the future. But where we cross the line in calling something an anxiety disorder is when that fear or worry negatively and consistently get in the way of functioning and development. So maybe I'll pause here. I'm going to look quickly at the time. Okay, I've gone on a little bit. I will speed up my pace in the next piece, but maybe we can have a couple of minutes here for questions. And I promise anything that's put in the chat box, I will take some time after this talk or tomorrow. I'd be happy to answer them in more detail. And if there's not questions, I'm not sure who might be moderating this, but if there's not questions, then I can just proceed.
Can I ask a question about kids waking up at night and saying, they're worried, they don't know why, they're anxious, and even when they're older, at what point do you start to worry about that?
Yeah, I mean, again, at risk of oversharing, my 18-year-old last week woke me up at 2 a.m. and she was worried about the fact that she couldn't sleep. So again, and this can be something that happens to all of us, is like worrying about when you're supposed to worry or worrying about bad things happening. And she was sort of getting panicky because she was supposed to study for exams, but she wasn't sleeping and watching the time and so on and so forth. So again, worry, anxiety, that's not a horrible thing in and of itself. I think some people are more geared to sort of be reactive to that. And again, I'm a bit more revved. So what the advice I gave my 18-year-old is, sometimes I'll wake up and I'll be revving and thinking about things. And then I might start to think, oh, this is really terrible, I'm not sleeping. But you just need to get out of the mode. So, that's when sleep hygiene comes in. So rather than laying in bed for more than 20 minutes, you got to get up, change the scene, maybe some water, some tea, change the scenario. Don't catastrophize the fact that you're not sleeping. No one's died from lack of sleep. Pull yourself together, distract yourself a little bit, recognize that, almost everyone worries at different points, which includes in the middle of the night. So again, I think that the focus is on kind of coming to a reckoning as you're growing older that anxiety is going to be a part of life. And we can manage it. And sometimes, it is really darned uncomfortable. And yet when it happens, we move forward the best we can. And again, I'm not trying to minimize any distress here, but really in the end of the day, it's that thing, like when we're raising our kids, to kind of let them know, you know what, I get this is scary or whatever it is. And yet we will try and move forward. Anyway, that's my abbreviated version of the answer.
Dr. Stewart, there's two questions in the chat that have come forward. One is asking about the differences between boys and girls. And is there any differences between boys and girls and anxiety presentation? So how they actually do. And the other is looking at the correlation between antidepressants. Can retrain a teen brain to respond in a more calm manner.
Okay, so I'm going to save that second question for this second section, because it's more focusing on anxiety disorder. And again, why I very intentionally spend a big chunk of this talk talking about normative anxiety is because something that folks with anxiety disorders tend to suffer from more than other folks is sort of the anxiety of anxiety, if you will. So again, anxiety and fear are normal. And now I've babbled on to the point where I've almost lost, I think I did lose the first question.
Oh, so yeah, that's great. Thank you. Yeah, and it was asking if boys and girls present anxiety.
Yeah. So in general, females, whether girls or adults, tend to have a higher rate for anxiety disorders. The expression of anxiety can definitely be in different ways. And in boys and girls, so not to stereotype too much, something that might surprise some people is that anxiety can be expressed with violence or anger or stress. So it's not necessarily always like that character you would see on that Pixar screen, but the expression of stress or anxiety can come out with sort of like little explosions, that kind of thing, that might be a little bit more common in boys than girls. So, but once again, anxiety, fear is something that happens to all of us. To the level of what we would call a disorder, it tends to be a bit more common in girls, but it's expressed in many different ways. And then maybe second question, I'll just hang on and we'll till we get to the end of the second session, because again, we're at 6:32, and it's very important for everyone's mental health to have time in their evening. So if that's okay, I will push forward.
Great. And if people have questions as we're going through, then Dr. Stewart, I'll just encourage them to put them in the chat, and you can always revisit them later on, or you can actually address them after the presentation too. Okay.
Absolutely.
Thank you.
For sure. Exactly. So really, in terms of looking at things that may influence fear or anxiety to go overboard, if you will. So everyone's an individual. Like I said, everyone experiences fear or anxiety. But your temperament, just what you're born with, you don't pick it. That's just what it is. That's something that influences the vulnerability to develop a disorder or not. There's a trait known as BI, and for short, or behavioral inhibition. And this can be picked up right from when someone's a toddler, whereas just their tendency to be a bit more overly cautious, fearful, and avoidant. So for those individuals, they may be a bit more likely to develop a disorder, but it's definitely doesn't mean that that's going to happen. If you're the parent of a child who's got behavioral inhibition, maybe your job is to kind of help them go out and face the world and do those things that are maybe not as natural and a bit more unpleasant for them. In terms of genetics and familiarity, we know that individuals and kids who have relatives who have an anxiety disorder are at increased fold risk. And also the way you sort of think about things, your cognition, which is of course related to genetics and your environment. But factors that are important around anxiety and anxiety disorders include poor tolerance of uncertainty. And I think this is something where like the whole globe is faced with right now is uncertainty. How much longer is COVID going to go on? Is it going to totally blow up? Is it going to go away? Is it fake news? You know, what's the real deal, and when's it going to end? If it's going to, well, of course it's going to end. But so for those individuals who are born with more difficulty dealing with uncertainty, they may be more likely to develop an anxiety disorder. And again, it's just the way they're made, right? For some people, it's harder for them to tolerate not knowing than it is for others. And something that can be influenced by environmental influences as well as others is sort of your cognition or thinking. If you're thinking the world is sort of a dangerous place and there's people or there's, you know, stuff lurking around every corner, as opposed to, oh, you know, the world is full of rainbows and butterflies, you know, that sort of mindset can influence vulnerability towards an anxiety disorder. And I won't belabor this too much, but just to say that there's been a fair deal of brain research over the decades that have implicated the sort of thinking part of the brain, prefrontal cortex, so kind of under my forehead here, the deeper part of the brain, the basal ganglia, or the amygdala, which is near the basal ganglia. And the amygdala is that sort of primal piece that's supposed to be reactive, and the prefrontal cortex is the part that's supposed to interpret. Okay, if there's a dangerous signal, is that a false alarm, or is it real? So this interaction between these parts of the brain also play a role in terms of whether an anxiety disorder emerges. But again, to come back for a take-home point, we are not to fuss as parents or human beings when we experience anxiety and fear, when our kids do. The time maybe to become a bit more concerned is if there's awareness that it's really getting in the way of functioning or growing at home, in school, or socially. And really the goal of treatment for anxiety disorders is effectively to, to enable functioning. So I think this might tie in a little bit to the question about medications, but there's many different ways you can regain functioning across different areas of life. And really the main goal is to enable ongoing growth, life experiences, and learning. And again, this is not just contained to kids, but of course kids and youth they might have a little more plasticity and resiliency in their brain, but even folks like me, old folks, we can still, learn new ways of functioning to have resilience moving forward. So in terms of treatment, really what we know is earlier intervention leads to better long-term outcomes. And there's a number of different resources. So I'd be happy to share this list, but just one that's very good in general is the Kelty Mental Health Resource Center, which is at the Children's Hospital. The Child Mind Institute out of New York has a fantastic website. And also Anxiety Canada is really great as well. So there's a number of different resources that you can refer to if you're concerned. So the main foci of treatment are really to educate or to talk about what some of the triggers are for the anxiety, what the responses are, and the things that keep the anxiety going. The real mainstay of anxiety disorder treatment is something we call cognitive behavior therapy. That includes pieces. The cognitive part is about shifting the thinking about anxiety, or shifting that notion that, oh, it's so dangerous if you feel anxious, or shifting that real discomfort with uncertainty towards an acceptance of, oh, well, we don't exactly know what's going to happen. There's a behavioral piece of CBT, which is around the doing, decreasing avoidance. And again, I probably can't say it more. Avoidance was one of the biggest enemies. So fear and anxiety, and especially in a disorder, can lead to avoiding more and more and more, which kind of shrinks your life more and more and more. So rather than helping, it actually gets in the way. So the behavioral component of CBT is really around facing fears or exposing oneself to what the worries are. And then there's also that physiological or feeling piece for some kids or youth or adults. They may have a really hard time tolerating if they have those fight or flight symptoms or sensations where they're feeling super panicky. In addition, another approach that's been very well proven in kids with anxiety disorders are medications, and that includes serotonin reuptake inhibitors, or SSRIs. And those SSRIs, just to address the question that came up last time, if CBT is not working, SSRIs can be the thing that really helps kids or youth to get over the hump. They may feel like, oh, it's totally impossible for me. You can tell me I need to go back and face all these things in my life, but it's absolutely impossible. And what the medications can do is sort of turn down that intensity. So it's not the absolute answer, but it can enable or help a child or a youth or an adult to be able to get back into those usual aspects of functioning in life. So what can happen in families is something called accommodation. So accommodation is something in which the family members, often the parents, want to protect the child from their anxiety. And they might enable avoidance. Unfortunately, that unintentionally tends to worsen things, because what happens is when the child is allowed to avoid that thing that's going to make them stressed, they feel so much better. So that becomes their go-to, like that is the thing they're wanting to do to not feel so upset in the future. And what that does is it does not create a long-term solution. So in that evening, maybe, you know, they're more relieved and happy, but the next time they come to have to do that thing, it's going to be even harder, and it's going to make avoidance more likely. And in the end of the day, really, the problem with avoidance is that it prevents new learning. And it prevents kids from learning how awesome and strong they are, that they don't even know because they haven't necessarily done these things, especially if they don't like uncertainty. Anytime they're going to try and do a new thing, there's going to be a lot of anxiety related to it, and they're never going to dispel the notion that they're terrible at this thing or they're awful if they don't actually try it. So here's some of the things that tend to drive parent accommodation. Some parents may worry that distress is harmful, so it's going to somehow wreck their child. Unfortunately, that helps the kid avoid triggers and prevents them from learning. They may doubt their child's ability to tolerate distress. They might think, oh, my child's going to go, quote unquote, crazy. And they might actually discourage the kid from, oh, don't try that. It might be too much for you. And sometimes they may have difficulty themselves seeing their child in distress. And then the child can see that they're distressed, and then they think, whoa, my mom or dad is really upset now. So that really means that this is big trouble, and I definitely shouldn't do that thing. And tolerating with their own distress. So again, these are all things that come from a very good place, but they tend to serve as accommodating factors for parents. So with parent accommodation, or this sort of need to protect the child from distress, it's focused on like basically trying to get through the day, trying to keep their job, trying to get their kid to school, that kind of thing. So it's great for short-term functioning, but it also kind of reflects decreased willingness to set limits. So if you, and again, I'm as guilty as anyone, like if you're trying to get through the day, it can make it harder to sort of set lines in the sand, if you will, if you've had a tendency to let the child avoid their distress by not doing that thing. And again, sometimes something that drives parent accommodation is just fatigue or burnout. And especially that's something that's very familiar to us all these days is, you know, we're kind of at the end of our ropes a little bit and just needing to avoid the conflict and just get through the day. And again, I'm just looking at the time here. So really, in summary, quite often parents can, from a very well-meaning place, trying to lighten the load of their child. It's very natural, well-intended for the short-term benefits to keep their child from feeling that distress, to keep them functioning in the moment. However, just like this child who's got a, I don't know, let's say sprained ankle, if the dad doesn't let that little guy try and walk with his crutches and then with the cane and then on his own again, then that little guy is not going to be able to walk and run normally in the future. And this sort of protection can actually prevent that, you know, quote unquote injury from healing. Oops. Okay. Okay, so again, just me being aware of the time here, it's 6:44. Should I blow through into the COVID piece, or do we want to do a question or two before then?
I'm looking at the chat, Dr. Stewart. So we have the one question around the antidepressants. We have a question around if one parent already has anxiety, how do you not pass that on to your teens?
Yeah.
Such a great question. And then the others were just letting me know that they're most anxious to see you again and to have access to your video. So
Okay.
The newest question, unless there's anyone directly from the audience who has a question, if you want to address that one or hold on to it for later on, either way, it's up to you. And just in the spirit of time, why don't we go ahead then, and then we'll come back.
Okay, so now all of that being said, and so again, it was such an excellent question from the parent who deals with anxiety. And again, we all deal with anxiety. Some of us deal with anxiety disorders. And of course, you don't want to pass these things on. So I'm very happy to share those slides. But again, trying to fight against that instinct to protect your child from feeling discomfort, I think is the way to go. So where we talk about exposure being a treatment for anxiety disorders for parents, and I co-lead parent groups, one of the biggest exposure for parents is having them witness their child being upset or distraught. So we do treatment for OCD, but having the parent be able to hang tight and not jump in and rescue the child can be really one of the most important things. Yeah, so let's talk about COVID and anxiety. In terms of looking overall at predictors for anxiety among Canadians, the Mental Health Research Council of Canada, they did a study. This was on adults though, but they found that those adults who are parents with children in the home and those who are younger were more likely to experience high anxiety. And we all know that parenting anxiety and depression are really huge during COVID, related to things I really don't need to explain to you, I'm sure. In terms of looking at international child mental health outcomes, so moving beyond the parent, I've just highlighted here a few studies that have been done. One was a systematic review looking at child and adolescent studies. And what they found in terms of looking at overall mental health impacts on kids and adolescents in the COVID era, the particular area of concern is for depression and anxiety in adolescents, more so than say in children, and more so than say other disorders such as psychosis or other conditions. However, the quality of studies that had been done is fairly low. And again, that's understandable because people are trying to come together and design these studies fairly quickly. In a study that I found sort of helpful, that was well powered, it was looking at Chinese adolescents, and it captured pretty high rates of depression and anxiety symptoms. But more importantly, they looked at predictors of what helped. And they found, interestingly enough, and I'm sure your moms and the grandmas and grandpas would not be surprised, sometimes it's the obvious things. So those youth who had better nutrition and moderate to high physical activity levels did better. Basically the context of when we started the study was realizing that a lot of the focus that was done around these COVID studies was largely on adults. It was just asking one person's perspective and just at one point in time. Very few were asking about change over time. And really, we didn't really know much about the clinical significance. So that whole thing I was just going on about like what's normal or normative fear and anxiety versus what's what we would call a disorder. So a lot of those surveys didn't really discriminate in that way. I mean, of course, everyone's feeling more stressed, but they didn't necessarily capture the level of disorder. And also there was little focused effort on vulnerability groups. So really that's what led us to design with a PICS study, or the personal impacts of COVID study. And we really did our best to try and work with a number of different groups in the community as well as government to try and make sure we were asking the right questions, wording things in excuse me, the proper politically correct way. And really we wanted to know about people's experience as they're living through COVID. So this is our face page, and I think it's in the chat already, but you could just Google PICS or PICS, Personal Impacts of COVID, and BC Children's Hospital, and this would pop up. And really what we did was we designed a survey, but I'm not going to drag you through all that boring parts, where we integrated some pieces like some standardized screen to determine the percentage of people who may have what we would call sort of not just this feeling or emotion, but something you would call a disorder. Also, there's a pop-up that occurs in the survey that directs people towards resources. So if they've answered in a way that indicates that they or their child might have generalized anxiety disorder, depression, or OCD, there's a pop-up that can lead them or direct them towards resources. So here's where we're at. We have aimed for 3,000, not giving up yet. We're at about 2,100, and we're going to be probably continuing new recruitment, not probably, we are going to be continuing recruitment until June. And at this point, we have 625 parents of kids who are between 0 and 18, 873 adults who are not. And then we have information on kids from 340 parents and self-reports from youth, 111 youth. What you'll notice is that it's predominantly white sample and among the adults, female. And in terms of the adults, the parents tend to be between the 30 and 50-year age range, and the non-parents are a bit younger. This is largely Canadian sample, particularly focused on British Columbia, and we've done a lot of our recruitment through social media and a number of different sources. What we want to get in the end of the day is sort of reasonable representation, so that we know that the information that people are providing to us is sort of generalizable, if you will, or representative of the population. And really, in particular, what we're interested in is how kids and youth and parents are doing and what's happening with them over time as things just go on month after month. Also interested in those groups where they had pre-existing medical or mental illness conditions, those who are marginalized or with low income, or those who may be in rural or remote or northern communities. So in terms quickly, just looking at some of the outcomes. So we wanted to look not just at mental health outcomes, but overall. So if you look at this graph, we got physical health on the bottom here, mental emotional health, quality of life, and relationships. And what this is showing us is the child outcomes. So the blue is what the kids are saying about themselves. The orange is what the parents are saying about their kids. But big picture here, I don't want you to get lost in all the numbers. This is the percentage of people who are not doing well. We're saying those areas with them are just fair or poor. So you'll notice that where there's the highest peaks is around mental and emotional health. So forget this notion about physical health or kids getting super sick of neuroinflammatory or other inflammatory or respiratory conditions. Is that kids are not doing well from a mental and emotional health perspective. Then we look at parents and adults, and the parents are the ones in blue here. We got start of the pandemic and the past 2 weeks. So this kind of reflects a little bit what's happening over time. And what you can see with physical health, it's getting a bit worse over time from the beginning of the pandemic to now. Mental emotional health getting a lot worse. Quality of life getting worse, and relationships and social health is worse. But again, I think one of the big takeaways here is for us to be focusing on people's mental and emotional health. And that includes not just for all of you, your kids, but yourselves. So in terms of looking at rates of, I'm going to flip through, rates of disorders, here's just a slide showing this is the kids as reported by parents, the rates of something called, this thing we call generalized anxiety disorder. So about over 15% of kids screened positive to the thing we had. We also asked them if related to those symptoms, they have a hard time functioning. Because again, we come back to that notion of, it's not just if you had these symptoms, is it getting in the way of your functioning? So we have nearly 10% of kids self-reporting, or sorry, parents reporting on their kids that they have significant problems with functioning related to anxiety symptoms. This red line here, which you'll see is way lower than the top of the orange or the blue line, shows what you would expect in normal times. And that's based on a Canadian study. This is child report, what you would expect in normal times, non-COVID times, for the level of GAD, or this thing, not just anxiety or worry, but this thing is called a disorder. So you can see the kids are at multiple fold times that around GAD, as are the parents, much more so. So parents are having a particularly hard time. We also looked at some of the other outcomes to look at by, response to a screening measure. So this is the kids by their parent report, the kids on themselves, parents on themselves. So if you're looking at this overall picture, the parents are reporting that their kids are having a hard time, but the parents are reporting that they're having a harder time than their kids are. And why is this important? Well, it's sort of obvious. As a parent, you are the main caregiver for your child. And like when they say, when you get on an airplane, when we used to be able to fly on airplanes, if something happens, the oxygen masks come down, you need to put it on yourself first before your child. And it's very important because your child depends on you. So you need to look after your own mental health first. And what we're seeing is that parents are really struggling with anxiety and depression. And also OCD is my area of normal study, so I couldn't resist. But also in a time about contamination, it's very important for us to take a look at that. But similarly, there's elevated rates. There seem to be elevated rates of OCD. And when you look at Accommodation, so how kids are doing of having at least one of those 3 mental illnesses by those screener measures, by self-report, about half of kids are. By parent report, about a quarter of the kids are. And then by self-report, about half of parents are. And again, this isn't to totally freak people out, but it's really important to kind of know where we're at. So lots of parents are saying that they need help, largely to help manage their kids' emotions or their own well-being. They're largely wanting that from a counselor or a psychiatrist, a psychologist or a psychiatrist. We have about a quarter of parents who say they need that care but haven't received it. And about maybe a third to a half of parents who've been able to access some mental health support during the COVID era. And where they've accessed that from tends to be from either a private counselor or psychologist or a family doctor or family or friends. And then another thing that was important for us to look at is, what might be barriers, the things that kept them from accessing the support they need. And really the largest barrier is limited availability. So I think that's really informative for us. We've gotten some limited funding from BCCDC and the Ministry of Health and from the Children's Hospital Foundation to start running this survey. But I think it's really incumbent upon myself and Dr. Samji and others to kind of share this information so that we can respond to people's needs. So really in terms of the summary of our findings from the PICS thus far, and again, we are not done, really beg you guys, if any of you are connected to influencers, we had our whole team meeting today was about influencers, and that's totally beyond me. But if any of you are connected to influencers or any of you are social media influencers, we would just love for you to share this because it would be really, really valuable. And we will definitely be sharing this information with government and other bodies. But what we found is that mental and emotional health seems to be disproportionately affected by kids and parents and other adults. Depression, GAD, and OCD rates are 3 or 4 times greater than you would expect. There's a lot of need for support. A good chunk of people, but not the majority, are obtaining mental health support, and unfortunately, limited availability is a main barrier. So I'll just wrap up the talk there, but not to end on a negative note. I think there are things we can do, and as we come out of COVID as well, there are lots of glimmers, and there's a lot of room for resiliency. And just because we're stressed now or feeling anxious now does not mean it's not going to get better. And attending to things like, so predictors of better mental health outcome. Again, I feel silly almost saying it, but it's been shown. So exercise, literally getting outside. You don't even need to be exercising outside, just being outside is a predictor of doing better. Eating good food. These are all things that can be really helpful to us, and having some social connection, and it doesn't need to be in person, but these are all things that we can do for ourselves, because as parents, we need to look after ourselves so that we can look after our little ones, and to cut ourselves some slack, because we are going through unprecedented times, and yet here we are persevering, we are pushing forward, and there are things that we can do. So not to get overwhelmed by these things, but also to not avoid it, because remember, avoidance is no good. We can't avoid this knowledge. We need to go forward, face the world with knowing where we're at, and knowing we can help model to our kids that we will get out of this. Oops, I moved into preachy mode. I apologize. Sorry. Oh, and it's 7:01.
Oh, well, I have to say your timing is brilliant. You're a master at watching the clock. Thank you so much. You know, Dr. Stewart, I can't thank you enough. I was sitting here and I'm taking notes and just thinking about all the different messages you've sent to us this evening, right? So I'm walking away with this notion of fight against wanting to protect, right? So, you know, and it is, as you say, it's our nature as parents, right? We're like, oh, we want to keep them safe. But really, we do them the greatest disservice by trying to hold them close, right? And you know, that push and pull that we feel. So thank you for naming that for us, right? And giving us that sense of, okay, we need to let them go out and really experience the world, right? If you will, right? And then I love that you shared your research with us that points to the fact that absolutely, as parents, we are continuously thinking of our children, right? Our children and our youth, and they are so instrumental to us, right? And which is why, you know, we have 66 people here tonight coming to be a part of this, right? And so, but to remind ourselves that we're also living through this pandemic as individuals too. So again, thank you so much for naming that for us. I feel like we only got this one little precious hour with you, and I know there's so much more that you can share with us. I do want the parents to know that you've come out of the goodness of yourself for this, right? So there's no gain for Dr. Evelyn Stewart to be here tonight.
You guys asked me what's my speaker fee. No speaker fee. No, this is me being me. But also I think for whatever, if it's possible to get more people to fill out the survey, that's great. But if not. And I'd be very happy to come back and speak in the future. And as we're emerging out of COVID, all of that kind of thing as well.
Well, I'm sure we're going to take you up on that offer. So thank you for already extending it. And yes, I really do urge everyone, both from the Vancouver College and from the LFA community, because we're both here this evening, to take some time. It's 10 to 15 minutes. As Dr. Stewart has said, right at the very top, you can see she has shared the link directly to the survey. So you can copy it right out of the chat. You can click on it and do the survey right now. And then I will make a point of having that link available as well on Vancouver College's page, and I'll share it directly with LFA, my contact there as well, so that it can be top of mind for people. I also know that people are asking about the video because, as I said, you've given us a wealth of information tonight. I know a lot of people want to go back. It will be accessible to parents at both schools, so just stay tuned for that, but you'll get a notice for how you can see that. Certainly Vancouver College, it will be on the Parent Talk page, and I'll look to work with LFA to see how to make that happen. A really, really sincere thank you for giving us your time tonight, sharing your experience, your wisdom, both as a researcher, a clinician, and a parent, right? Just giving such authenticity to everything that you're saying. And thank you for just brightening our day with sharing all of your knowledge.
So we all need to just pat ourselves on the back. Let's just all, Monica, please, there, thank you. And other Monica, I can't see you. We all need to pat ourselves on the back, take a breath. We're doing it. We're doing the best we can. That's all you can do. And we are going to push forward and continue on.
Well, it was a delight to have you join us. And as I have said to the parents that are still here, if you want to hang back and ask some questions to Dr. Stewart, I know she said that she's accessible at this time if you'd like to. If not, this sort of formally concludes it. Thank you, parents, for making time tonight for this really important topic. And it tells me if we have 66 parents here tonight, this is obviously top of mind for our communities too. So wonderful to have you, and a huge thank you again to you, Dr. Stewart, for being with us. All right, so I'll ask people if I'm happy to monitor the chat, and then I'll also ask people if you want to turn on your microphones. By all means you can, you'll have to unmute yourselves to ask any questions of Dr. Stewart at this time. Otherwise, as I said, enjoy your evening and do get outside. It's so gorgeous
outside. It's medically proven.
It's to be there. Okay, so I'm seeing a whole bunch of thank yous and thank yous and thank you. Okay, so one question we're being asked right now is, what is the advice for COVID anxiety when the goal, unlike other anxieties, is avoidance? So sort of that,
this is it. And it's, I mean, that's the $1 million question, right? So I think what I turn to, again, when you're trying to figure out like what's functional, what's not functional. So I say if our provincial health officer is advising things, that's functional, right? So it's never a bad thing to do what Bonnie says. I think pre or post COVID, I would just say she's won me over. But anyway, different topic. So I think it's a functional if you are doing the restrictive or avoidance pieces that are being advised. I think what you need to watch for, or the thing to be cautious of, is overdoing it, right? 6 feet is 6 feet. 6 feet is not 600 feet, and 6 feet is not like infinity feet, right? And hand washing for 20 seconds is hand washing for 20 seconds, is not hand washing for 20 minutes. So again, I would say, and again, not being too rigid because there's this whole component of uncertainty, but I would certainly say it's very appropriate to follow the advice of our provincial health officer, who is being, I think, informed by evidence or, broader groups, and to try and use that as a bit of a guideline. So I'm not saying be reckless, and I'm not trying to suggest there's no danger anywhere out in the world. However, to not let ourselves be totally overruled by uncertainty and this fear of not knowing what's going to happen, and just trying to maybe stay focused on what are the restrictions, and do the best you can with what you've got to abide by those, and also to stay focused on function.
That's a wonderful way to phrase that and to think about it. We have another question that's coming up for you as well. It's saying, what are your go-to self-talk expressions for kids to use when they start to feel anxiety? For example, when they have to speak in class.
Yeah, so my kids throw this back at me at convenient moments for them. Well, so I try to be fairly open, and again, anxiety or fear is a part of life. So, we will all go through our things, but it's sort of a bit of a mantra in our house is face your fears. So if I'm stressed about something, and it actually came up before my talk at Fraser Academy, because I was concerned because I have 2 kids who go there, and then the notion of, because generally if you're the parent of a teenager, they don't want to acknowledge they're connected to you anyway. But then if you're giving a talk at the school where they go, it hit a new level for me. So I was feeling like, how am I going to be cool and whatever and all of that stuff. And I was mentioning at the dinner the night before, and they're like, Mom, just face your fears. That's it. So it's sort of this mantra. face your fears, and continue, do the best you can and move forward. I think I may have gone off astray a little bit on that answer, but really in terms of the language I use with, my patients, with my own kids, with the friends of my kids is less about like being afraid of fears, like, oh yeah, acknowledging, yeah, that's a little bit scary, but you know what? I think you can do it. And it's not, I think you can do it amazingly well, right? It's that I think you can get through it. And then praising them doing whatever it is. It's not that they got a gold star or gave the best debating speech or nothing about that. It's praising the effort to expose yourself to the world, to try this new thing. And not fooling yourself that you need to be perfect or whatever. The focus is on, you know what, you can get through it. And even if it's a crappy day, you come home, I don't know, we go for a walk, we eat ice cream, we do something else, but I'm so proud of you because you did that. I couldn't be more proud of you.
That is wonderful. My goodness, that is, I need to, I'm glad we're recording this. I was just going to say, I need to hear those words going forward, right?
Yep.
And I think our one last real outstanding question for you is, where will I be able to, oh, no, that one. No, that's just a second. This is the one about us parents and how do we not pass on our own anxiety to our kids?
It's tricky, okay? And I think having a poker face can come in handy, just like, remember when our kids were like little toddlers and they would, learn to walk and then they're, doing something and they fall and they skim their knee, and it's that moment of silence before they're about to scream in terror because they got a boo-boo on their knee. For me, I just have to tell myself to not be reactive, not run over and like, oh, you're bleeding out, call the emerge, CPR. No, it's about like containing it and like, okay, you got a boo-boo, let's distract and move forward. Even if you're feeling on the inside, like this is terrible. So I think a bit developing the poker face, and even if you believe it or don't believe it, sharing with your child or youth, your faith in them. So even if you can't have faith in yourself, maybe about bravery and doing this thing, you can just do your child the best favor, keeping them from doing, and just saying, you know what, it's okay if you do a belly flop in life, but I have faith in you, you can give this a try. And, I'll just be so proud of you when you do that. This is fantastic. And kids, or teens especially, love to train their parents. Like the thing I said about my kids, right? They're like, mama, and they're sort of smirking and like elbowing each other when I said I was nervous about this one talk. They're like, you got to face your fears. So that's, and they love, and they can be this two-way street. So it's having some honesty as a human being. You can share that you got these emotions and feelings, but it's not pathological. It's just you're feeling stuff. And yet, nonetheless, you're going to give it a go. So, or you could share that you've struggled with anxiety and maybe it's gotten in the way, and you could see that there could have been stuff you could have done. But again, it's not a sob story about you. It's just saying, but I can see you're so strong and you could do these things. And I could, I can see that I could have done it. And I just want you to know, like, it would have been scary for me to do it. And I know it would be scary for you to try, but I just think you can try. So I think it's that sort of perspective, really.
That's it. What lovely language you're giving us, right, to share. So thank you for that. I want to make sure that I'm not excluding anyone. We still have 33 people that are with us. So I want to make sure that they get a chance to go on the mic if they want to open up and ask you any questions directly. I am still looking at the chat. I'm not seeing any further questions in the chat, but I am wanting to make sure that the people that are still with us, that they feel free to go on the mic if they want to.
Hit me. I might not have the answer, but you can always ask. I'll try my best.
Yeah. You'll give it a go.
I'll give it a go.
Yeah. So I'll just see if there's, I'm not seeing anyone else turning on their microphone. So maybe it's just a really, again, another wonderful time to say a big, big thank you. I'm seeing lots of thank yous coming in again, and that it was a great, great presentation.
Okay, everyone's homework assignment is to get outside, maybe just like even 2 minutes. It's beautiful out there.
So go and enjoy ourselves, right?
Yeah,
Thank you so much, right?
Yeah. Okay.
Okay.
Good night.
Thank you so much, and thank you.